Heart disease, it is the leading cause of death in the United States, but there are things that we can all do to get heart healthy, and there are so many dollars going into research to help those efforts. So this morning we'll take a look at some of that. What's the deal with good cholesterol? Is it really important, or could high levels actually be a problem for other health problems? Also, how cycling reduces your heart disease risk, and usually oxygen-rich blood helps keep your heart muscle healthy. Why oxygen levels at the top of Mount Everest, we're talking very, very low, might regenerate heart muscle. This is groundbreaking as well. So joining me now, Dr. Pragnesh Parikh with the Mayo Clinic. Appreciate you coming in. You know, these are interesting studies, especially when it comes to cholesterol. HDL is the cholesterol that you want more of. It's the high, so you want more of it. At least that's what we thought, because it was good for our health, but this study looks at it a little differently.
So for the longest time, we've had a sort of simplistic view of cholesterol. There was the bad cholesterol, or LDL, that raised your risk of heart disease, and then the good cholesterol, HDL, that lowered your risk of heart disease. And we said, well, let's raise the good cholesterol, let's lower the bad cholesterol. Well, our view has kind of become more nuanced over time. This study took a large population of patients in Canada and looked at their HDL levels and what that meant for their heart risk. And what they found was that in people who had low HDL, those folks, males less than 40, females less than 50, they had higher rates of not just heart-related death, but all-cause death, even cancers. So low HDL was a marker for being sick overall.
But then the high levels didn't really show anything better.
So there can be too much of a good thing, actually. I can't tell you how many times I've had a patient come in and tell me, well, my doctor says I have a high level of bad cholesterol, but it's balanced out by the good cholesterol.
Yeah,
well, it turns out that's not really true. Folks who had really high levels of good cholesterol, men over 70, women over 90, those folks also had increased risk of death.
And we were talking about some of the things associated with it, though. Sometimes it's the smoking, it's drinking that send those levels higher or lower. And so getting rid of those habits will help to level it out, which that kind of happy medium is where you want to be. Also, let's talk about cycling, because this is kind of simple. We know that exercise helps to strengthen our heart and keeps us less at risk for heart disease. But what this kind of is encouraging people to do is find creative ways to get your exercise in.
Exactly. There were a couple of studies that came out about the same time, and it was a large population of Danish folks in their middle age, about 40 to 60 years old. And what the take-home point of these two studies was really that it's never too late to start exercising. Folks who started exercising during the study period actually got some benefit in terms of heart health, and it was as little as 30 minutes of cycling a week that gained some benefit.
And we were talking, I mean, it could be as simple as, instead of driving to the grocery store, you hop on your bike and you go as a family and just grab the items, everyone pull their weight, and that could help. Okay, quickly, because we don't have a lot of time, but we never thought that we could regenerate your heart muscle. And this new study looked at mice, which then they'll have to kind of see how it works in humans. But in those low oxygen levels, they actually started to see these cells regenerate. I mean, that's phenomenal.
It's an exciting new study out of Texas. They took mice and dropped them from an oxygen concentration that we normally breathe, around 21%. Gradually, over a couple of weeks, took them down to 7%, which is the amount that you might see at the peak of Mount Everest. And what we found was that when the oxygen concentration of the air they breathed was lower, their heart cells actually turned that switch back on that allowed them to divide and kind of heal. And that's exciting news. It could be groundbreaking for the areas of treatment of heart attacks and heart failure.
Okay, so we'll have to see what happens in humans when they start to test it. Thank you so much for coming in. It was great. Very simple and well explained. If you missed any of this interview, you can watch it online at news4jax.com. You'll find it on the morning show page. Also, our Take It to Heart section is there as well, and that'll get you going.